Okay, a lot of patients want to know why their knee creak, why their knee pops, and makes funny sound when they walk or squat or when they walk up and down the staircase. Um, the thing is, sometimes if there are sounds that come from your knee joint and it is not painful and it is not too loud, it's actually nothing much to be worried about. Uh, but we just need to be worried about certain uh, conditions that may be associated with these symptoms that we may have to exclude. For example, if you have somebody with a lot of loud creaking sounds in the knee, it could be due to some problem in the articular cartilage. The knee joint, ends of the bone are articular cartilage. It covers the ends of the bone and it provides lubrication, articulation, motion. If let's say there is a cartilage lesion, it starts to break down and it becomes uneven, and this gives a lot of creaking sound from the knee joint. For example, I had one patient. He was about 16 years old, and he tells me that he has been having sound from the knee, coming from the knee, for the past 3-4 years, and he could just demonstrate it by bending and flexing his knee, and you can hear click clack, click clack, click clack, loud sounds. Now, when you put the hand over the knee joint, when he moves, you can actually feel a grating. This is not normal, especially if he's a young person. You don't expect him to have arthritis. And if you do X-ray, sometimes you can see on X-rays the skyline view unevenness in the bony structure of the kneecap. But sometimes it may look normal, and the next step is to do an MRI scan. MRI scan will show us whether there is a cartilage injury. So in this particular gentleman, there was a cartilage injury, and this condition is what we call an osteochondral lesion. So basically, part of the cartilage and bone started to break off and started to cause pain and creaking sound. The treatment for this is usually keyhole surgery to remove the unstable cartilage and bone and to stimulate new cartilage formation by a variety of techniques.